The good news is stopping smoking can significantly decrease the risk of lung cancer, with those benefits becoming evident within 5 years of stopping. And even though former smokers still have a higher risk of developing lung cancer than those that have never smoked, former smokers who quit for over 15 years have an 80 to 90% risk reduction compared to current smokers. Now, I don't mean to get on too much of a soapbox here, but I don't encourage my patients to avoid or quit smoking just because of lung cancer. I mean, that's a big reason, but there are multiple reasons for one not to smoke that we're going to cover here, and I think many of these reasons will probably surprise you. And I do want to say that I'm not trying to be all judgy pants with anyone that does smoke. It's just the reality is smoking is absolutely not good for your health. And again, this isn't just about your lungs. So let's get into these other negative health consequences. Cigarette smoking is estimated to be responsible for over 10% of cardiovascular related deaths because it can inflame the inside of your blood vessels, increase your risk of clotting, and negatively impact cholesterol. It also increases your risk for infections like the flu, the common cold, and even pneumonia. It can also increase your risk of type 2 diabetes, and this may be partly due to nicotine's effects on impaired insulin sensitivity. Osteoporosis and hip fractures become more of a problem with smoking as it can accelerate bone loss because it reduces blood flow to the bones. Nicotine can hinder the production of bone-building cells called osteoblasts, and it can also decrease the absorption of calcium. Now, many people have heard that smoking while pregnant can cause complications with the pregnancy, which is definitely true, but it is also associated with other reproductive problems such as premature menopause, infertility in both males and females, as well as erectile dysfunction. Those poor corpora cavernosa. And if you don't get that joke, that's okay. Please just refer to our video on how erections work. Smoking also increases the risk of ulcers, periodontal or gum disease, and even affects the eyes with an increased risk of macular degeneration and the development of cataracts. Pretty much up to half the people that smoke can be expected to die from a tobacco-related illness. Now, I do feel that we need to address the outliers, meaning you've probably heard someone say, well, so-and-so smoked cigarettes every day for nearly their entire life and lived to be 100. Well, so-and-so is exactly what was just mentioned, an outlier. Someone like this survives that long in spite of smoking, not because the smoking gave them some superpower to live longer, but because they had some extra luck. They may have had something in their genetics to make them more resilient to developing lung cancer. And it doesn't mean that this person didn't have other multiple health conditions that they were being treated for and couldn't have had a higher quality of life if they would have quit. Because again, quitting all forms of smoking, especially cigarette smoking, can greatly bring someone's risk level down and improve one's overall health and quality of life. Because this amazing machine